Yes, so I know I was kind of hoping that, if we were an island like New Zealand, but it just goes to show what we have been saying all along, that once this virus is anywhere, it's a risk everywhere. And in New Zealand, they were, I understand, international travelers who tested positive on arrival in New Zealand. So we all need to continue to be aware that this is going to be in our communities for some time. Same with what's happening in Beijing. I've certainly been watching that very carefully. Again, associated probably with transmission in a market. And, we'll get some more information about that over time. The genomics will help a little bit. There's not been any outbreaks that we've known to be the source be a food product, but we know that it's people that are associated with those food products that pass it on to each other. And if it's not caught early, again, we need to be really careful about that. So that's part of our whole strategy right now here in BC. We've managed to flatten our curve, but we cannot get rid of this virus when we still have people who are moving back and forth and bringing the risk that they have with them, not intentionally, of course, but because this virus is in many different places around the world. So we need to minimize the numbers of cases that we see anywhere here in BC, and that's part of our focus right now. And in public health, we need to manage every single case to make sure that we don't get these super spreader events. And some of them we can control, some of them we can't. We can't, some individuals may shed a lot more virus than others for reasons that we don't know. But what we can control is those environments that are riskier. And we can control the numbers of people that we're in those environments with. And that's where the important measures that we're putting in place in our workplaces become so key, so that we're not inadvertently spreading it in those settings. That's where the measures that we have in long-term care homes, where we know there's such a vulnerable population. And then in public health, we are working very quickly and carefully to make sure that we're tracking every single person. And that's one of the reasons why we are continuing to have that reduction in numbers of people who gather, because that allows us to find people quickly and contain the spread. And we need to modify our activities as we're going through this to make sure that we can stop explosive outbreaks and rapidly progressing outbreaks. And so we're watching again very carefully and what's happening in China, particularly right now in Beijing. Also in a number of the states in the U.S. where we're starting to see more worrisome symptoms like hospitalizations. And we know that that's what we call a lag indicator. It means that enough people have gotten sick with this that some people are getting really sick with it and ending up in hospital. And that's what we need to avoid. And we think with the things that we're doing, the foundations that we have here, that we've all sort of learned over this transition, that we can keep it at a minimum level and prevent those super spreading events and explosive outbreaks.